Today we're tackling a harsh truth about Brexit that politicians often prefer to avoid, the very real life or death consequences it's had for the UK's National Health Service. If you've ever wondered how Brexit might affect you personally, consider this. A recent study has revealed that Brexit-related nurse shortages directly contributed to hundreds of additional deaths in UK hospitals. Yeah, you heard that right. And let's dive into the shocking details. A recent study from the University of Surrey, published as an IZA discussion paper, has found staggering evidence linking Brexit to increased mortality rates in NHS hospitals. Specifically, the study estimates that in the 3 years following the 2016 Brexit referendum, the UK saw approximately 1,485 additional deaths per year due to the loss of EU nurses. And that's nearly 1,500 people annually whose deaths can be directly traced to staffing shortages caused by Brexit. And now let's unpack exactly how the researchers reached these startling conclusions. The study meticulously analyzed patient-level administrative data from 131 English NHS hospitals, and they particularly focused on hospitals varying pre-referendum proportions of EU nurses. Before Brexit, these hospitals employed anywhere from 0.5 to 22% EU nurses, averaging around 5.84%. And this range allowed researchers to precisely assess how hospitals more reliant on EU nursing staff were disproportionately impacted by Brexit, and the findings were clear. Hospitals with higher proportions of EU nurses faced significant difficulties immediately following the referendum. On average, each hospital experienced an estimated 34 extra deaths linked directly to the staffing shortages over the 3-year post-referendum period. And these aren't just numbers, these represent real people, real families, and genuine tragedies. But how exactly did Brexit cause such drastic nursing shortages? And the answer lies in the immediate aftermath of the 2016 referendum. Almost overnight, the UK saw a drastic reduction in the number of EU nurses coming to work in the NHS. And simultaneously, there was a sharp increase in the hiring of non-EU overseas nurses. However, these newly recruited nurses generally had lower experience and fewer skills, likely due to their lower salaries compared to their EU counterparts. And this significant shift in the workforce and the composition was identified by the researchers as the primary reason behind the increased mortality rates. And they rigorously ruled out other potential factors like changes in patient demographics, variations in hospital productivity, or alterations in other staff numbers such as consultants. In other words, the evidence conclusively points to Brexit-related staffing changes as the main culprit behind this disturbing trend. Professor Giuseppe Moschelli, the lead investigator of the study, put it bluntly. Brexit has had real life or death consequences for patients in our hospitals. He highlighted 2 critical takeaways from this research. Firstly, it underscores the invaluable role skilled migrant nurses play in the NHS, particularly in emergency care scenarios where expertise directly saves lives. And secondly, it reveals the dangerous over-reliance of the NHS on foreign nurses. Indeed, the study sends a stark message to policymakers and the public alike. Britain urgently needs a more balanced healthcare staffing strategy. Relying heavily on migrant nurses without investing adequately in domestic nurse training programs has left the NHS dangerously vulnerable. When geopolitical decisions like Brexit disrupt international staff movements, the fallout isn't just economic, it directly affects public health and patient survival rates. The NHS has long been one of Britain's most treasured institutions, often described as the nation's pride. Yet the Brexit referendum triggered a staffing crisis that fundamentally weakened hospital capabilities at a time when they were already stretched thin. And the resulting drop in experienced nursing staff led directly to declines in patient care quality. And this isn't just a statistical abstraction, it's a grim reality with tragic human consequences. And furthermore, these revelations could be just the tip of the iceberg. With Brexit fully implemented, the UK's healthcare system continues to face recruitment and retention challenges. And hospitals still struggle to attract and retain enough experienced nursing professionals here. And the ongoing staffing shortages aren't merely temporary inconveniences. They represent an enduring crisis that will likely impact patient outcomes for years to come. Critics argue that the government was warned about these potential consequences, but chose to dismiss them as Project Fear. Yet, the Surrey study clearly demonstrates these warnings weren't exaggerated. They were accurate forecasts of the damaging consequences that political decisions can have on vital public services like healthcare. And supporters of Brexit argue that Britain now has greater control over its immigration policies, potentially leading to long-term solutions for workforce shortages. However, the short-term consequences, as this study painfully highlights, has been severe and immediate. And this begs the question, was there a better way to manage Brexit without risking lives? Could policymakers have mitigated these consequences with better planning and transitional strategies? The study also raises urgent questions about Britain's healthcare future. How will the NHS adapt to these ongoing staffing challenges? What concrete measures are being taken to ensure Britain develops a sustainable and robust domestic nursing workforce? And perhaps most importantly, will policymakers learn from these findings and prioritize public health outcomes over short-term political games? The stakes couldn't be higher. Every day, NHS hospitals continue grappling with shortages that compromise patient care quality. Healthcare professionals tirelessly work under immense pressure, often facing burnout from understaffing and overstretched resources. And meanwhile, families across Britain depend on the NHS, trusting it with their lives. This research isn't merely academic, it's a wake-up call. It demonstrates how political decisions have direct and measurable impacts on public services, healthcare quality, and even survival rates. As Britain moves forward post-Brexit, addressing these healthcare staffing issues must be a priority, not an afterthought. At Outside Views, we'll continue to track these critical developments, bringing you thorough analysis of how political decisions shape real-world outcomes. And if you value informed discussion and want to stay ahead of these important issues, be sure to like, subscribe, and hit that bell icon for more insights and updates. Thank you for joining us today, and remember, informed debate leads to better policies, and better policies save lives. See you in the next video, and the next video is right here in the end screen.